Story 1. Reading these responses makes me extremely grateful for the few issues I have in my old age. Wishing you all relief from your illnesses and pain. Story 2. Take the 5 different pills prescribed by my doctor every day at the exact same time. Do not listen to the voices. Repeat. Do not listen to them. Story 3. The pancreas does not work, requiring 3 to 6 injections every day, or else you risk severe health consequences. Additionally, the medication can be fatal within minutes if the dosage is slightly higher than needed. It is humbling to see so many others dealing with this or other pancreatic issues. Stay healthy. Story 4. The pains do not stop. Urinate as soon as you feel a slight urge. Do not get too dehydrated or you will be dizzy for a couple of days. The hearing aids help a lot. Yes, the eyes should have glasses, but I do not have any for them yet. I am sorry. Story 5. You have cancer now. Take the medication on time, use the painkillers, and do not try to power through. Chemotherapy is on Wednesday, and the cat will try to suffocate you because she likes to sleep on faces. Story 6. The hunger and need to urinate indicators do not work. You have to manually check them every few hundred miles. If you feel sick, that is probably hunger. If you feel unwell and do not know why, it is also likely hunger. It has probably been a day or two. Do not urinate on yourself. Remember to take a break a couple of times a day to urinate. Story 7. Do you know about healthy sleep patterns? Those are not happening, nor are the triggers for hunger and thirst. You will gain the ability to talk for hours, but cannot guarantee it will be coherent. This only leaves me to say, welcome to the spectrum. Story 8. My stomach always hurts. Everything makes my stomach hurt. Sometimes it hurts a lot, sometimes it hurts a little. Sometimes I eat something and it goes right through me literally seconds later. It is just never in good condition. Story 9. Good luck. I had a catastrophic stroke in 2017. I have very poor motor function. I drink with a lid and straw. Otherwise, I spill. My speech is unusual and I have very low vision. I use a large monitor set to a low resolution so I can read. I bet you have never had to think about swallowing before, have you? Edit. My wife made a video of the first year of my recovery, starting about a week after I came out of a coma. Story 10. I feel like most people will respond with negatives, and I certainly have many of my own, but I want to shake it up by thinking of the positives. Have a blast doing jigsaw puzzles. Don't be afraid to grab one of the big boxes. You can do it. Your sister will text almost every day. She's funny and sweet. Be prepared to laugh. Try to schedule an impromptu visit to see her and her family. You'll really want to meet my niece and nephew. I'm pretty sure my cat thinks she's a dog. She'll follow you around the apartment. Watch out, she gets underfoot a lot. But you'll never feel lonely. Don't forget to call my mom. She'll want to hear about your week. Story 11. Have fun with a well-rested, very limber, and strong body that sleeps 8 to 10 hours a night without problems. Story 12. Do not try sleeping on your left side. You might get away with it for a few minutes, but you will regret it if you stay in that position too long. Story 13. Consult the list before eating anything or you will die an excruciating death. Do not stand up for more than 45 seconds or you will regret it. Do not bother brushing your hair or you will look like Princess Amelia before her makeover. Story 14. Please remember to take the anti-seizure medication and do not overexert yourself. Rest and relax. Story 15. You are going to crave alcohol constantly. Please do not give in to it. I have worked too hard to get to where I am. Story 16. Permanent back pain, permanent hip flexion and joint pain, soft focus eyes. You will need magnifying glasses to read labels and a 29-inch screen for computing. You will consume 197 pills of essential medications and inject 175 milliliters of insulin, as well as swallow large amounts of generic acetaminophen. You will not run. Your sense of balance will be slightly impaired as a side effect of one of the medications. Your diet should be low-fat due to the loss of some bowel control caused by radiation therapy for cancer treatment. Aside from that, life is great, considering the alternative. Story 17. Do not drink. Do not smoke. Measure your blood sugar. Take your prenatal vitamins. If a single hair on my unborn baby's head is out of place when I get my body back, I will find you and I will find a way to make you regret what you have done. Story 18. To reach the high shelf at the grocery store, you must first climb onto the first two shelves. To retrieve your luggage from the overhead compartment of an airplane, you must first climb onto an airplane seat. I am short. Story 19. Chronic fatigue, severe anxiety, arthritis, poor vision without glasses, fried or greasy foods cause immediate diarrhea, severe heartburn, serious health risks if medications are not taken on time, risk of a thyroid storm that requires monitoring, painful menstrual cramps with diarrhea, and my body craves exercise. Story 20. When it becomes unpleasant to look at moving objects, it is time to take your migraine medication. Otherwise, you will regret it badly. Story 21. Yes, everything hurts and has something wrong with it. Turns out not everyone has these problems, and I am working on it finally. Can you make a list of all the strange things you notice? I thought most of it was normal until recently. Thank you. Story 22. Oh, when it gets ready to rain, the brain will let you know with large amounts of pain. If you sneeze wrong, your back will go out for a day. Occasionally, your right foot will hurt for no reason. There are random hot flashes and an inability to sleep more than 2 hours. Various medications are in the kitchen drawer. The ones in the basket are for daily use. The rest of the drawer is for pain. Good luck. Story 23. I absolutely was not expecting all of these responses. I wish everyone well and good luck with whatever daily struggles and battles we face. Love and support from me to you. Story 24. 1. Feeling dizzy? Check when you last ate. You probably haven't eaten for an entire day. If you have eaten, take an iron tablet. You are constipated all the time. Accept it, it is normal for me. That weird nagging feeling when you are in the middle of doing something interesting but something is wrong. You need to urinate. Don't forget to go to the bathroom. Waiting to get tired to go to sleep? Don't wait. The feeling never comes. Follow routines. You need to have a routine, otherwise you will forget to brush your teeth and other daily tasks. Starting things is hard. Accept it. Sensory issues are present. Accept it. Avoid sensory issues when you can. Exposing yourself to them unnecessarily does not help. Welcome to life with attention deficit hyperactivity disorder and stomach problems. Story 25. To avoid looking in a mirror. It is uncertain when the psychological effects of observing myself will incapacitate me. Story 26. Klepophile syndrome, chronic pain syndrome, lumbar spondylosis, rheumatoid arthritis, degenerative disc disease, severe facet syndrome, spinal stenosis, cervical spondylosis, lumbar spondylosis, cervical radiculopathy, lumbago with sciatica, osteoarthritis, congenital segmentation anomalies of the cervical and thoracic spine, degenerative cervical spondylosis, fibromyalgia, depression, and impaired mood. Patient is 44 years old. Story 27. Asthma. If you work out or in the garden, especially if you go to the beach or go swimming and plan to exert yourself in the heat or humidity, take your inhaler. In fact, take 2. Story 28. Malleable penile implants are always erect and can be concealed with use. Enlarged male breasts are only enjoyable during intimate moments. Otherwise, they can be bothersome. Story 29. The constant pain. Spinal pain, neck pain, migraines, foot pain. If one part is not hurting, it just means another area is hurting more. The overwhelming lethargy. People do not understand how intense pain drains all of your energy. Story 30. Nothing. I would just sit back and watch them slowly mentally crumble as they realize that my body is nothing but a walking mess of mostly self-inflicted wounds because I am clumsy. For example, we were camping last week and went on a 12-mile hike. That night, I got double leg cramps, crawled out of the tent, and stood up trying to walk them out. Nope. I tripped and fell, hitting my head on a branch. Now it is 2 a.m. in the middle of the woods with cramped legs and a bleeding head. I would be like, yeah, good luck being me. Story 31. You will be in pain for no good reason. Fibromyalgia. Ditto for utter fatigue. You will get a lot of bad dreams. Most you can shake off. The ones that leave you with an erection and wanting to throw up will linger though. Those headaches? I have an active brain bleed. Run-of-the-mill migraines you can ignore, but if you start getting visual effects, get to the hospital immediately. Do not drive yourself. You might die behind the wheel and take others with you. Every time you roll over in bed, it will feel like you have wrenched your shoulder. From time to time, it will feel like your heart has become a frantically fluttering pigeon trying to escape your chest. Relax, it is not a heart attack. Until we can get it to happen while under observation, the doctor thinks it is just spasms of the pericardial tissues. Story 32. Oh yeah, ignore that clicking sound. I am pretty sure it is fine. Also, prepare to be sweaty literally all the time. Story 33. Your knees and back are in poor condition. Be sure to stretch for 30 minutes to start the day and then every couple of hours after that. 3 out of 10 is a good day. Also, if you eat dairy, there is a chance you may have digestive discomfort. Proceed with caution. Story 34. And just like that, I was humbly reminded that my own problems are relative only to my experience. Some of these comments broke my heart. Sending love to everyone who could use it. Story 35. You have 15 minutes to yourself when you get up. After that, be close to a bathroom. Your left shoulder grinds at certain joints. It is normal. It is just noise and sensation, no pain. Your right hand will sometimes spasm, and you will drop whatever you are holding. Always hold everything important in your left hand. Have fun figuring out what audible cue will be your new favorite saying for a few weeks. Do it, lady has been popular lately. People will come and talk to you. I do not know why. You have a face. I hope you are not introverted. Good luck. Story 36. If you forget to take your allergy pill for more than a day, the acid reflux returns with a vengeance. Obviously, the allergy symptoms also return, but the acid reflux is debilitating. Do not ask me how many times I have made that mistake or why the two are connected. Story 37. I am tall, so I am constantly vigilant of ceiling fans. They wait for the chance to bite us, and we cannot let them. Story 38. There is a baby inside, so please follow pregnancy guidelines and take your vitamins. Your legs will become increasingly painful throughout the day. That is a normal symptom of pregnancy. The constant anxiety is manageable for me, but it might cause distress if you are not accustomed to it. Due to the anxiety, decaffeinated coffee is recommended. Tweeze between your eyebrows daily and watch for chin hairs. Also, avoid bivalve shellfish completely. Story 39. You have to take all the medications from your neurologist perfectly on time or your day will be very difficult. These pills cause severe fatigue, so be prepared. You need to sleep for a minimum of 9 hours, but it may take about an hour to fall asleep, so factor that in. Regardless of how much you sleep, the fatigue will not go away. Sleeping a lot does not help if the sleep hours are not aligned properly. Wake up before 10 a.m. and you risk having a seizure. When your period is coming, you may have a seizure. Bad weather can also trigger a seizure. If you do not eat or drink the exact right amount, a seizure is likely. You must do everything correctly all the time to keep your brain stable. You have a non-convulsive type of seizure, so you need to pay close attention to your body to distinguish between a panic attack, dehydration, or a seizure, most likely a seizure. Because these seizures are not dramatic in appearance, others may not take them seriously and will expect you to go to work, do chores, and carry on as usual. Seizures are not simple events. There is a prodrome, an aura, the seizure itself, and then a postictal phase when your brain is recovering. During this postictal phase, you will be tired, confused, and fuzzy for the rest of the day. While you have no driving privileges during these times, life's other expectations remain. If you experience déjà vu, do not try to think about what feels familiar. Following that feeling could trigger a seizure. You also have joint hypermobility, and years of undiagnosed epilepsy have caused muscle issues on the right side of your body, known as Todd's palsy. These complications intensify your symptoms and cause constant pain. You are prone to dislocations easily. You must create a well-arranged pillow setup on the couch or bed to prevent dislocating your shoulder during sleep. Additionally, you are allergic to apples and almonds. Story 40. Crippling anxiety and terrible period pain, but not every month, bizarrely. You will not be able to do much without your glasses. Piling yourself into clothes is a bit like trying to put toothpaste back in the tube at times. Story 41. If someone had to live in my body for a week, I would just say, good luck. You are in for a ride. You will randomly get exhausted doing absolutely nothing. My stomach flips out over food it liked yesterday, and every joint sounds like it is auditioning for a horror movie. You will look calm, but inside the brain is running a non-stop talk show at 2 a.m. Also, get ready to be hot and cold at the same time for no reason. Have fun figuring that out. Story 42. Your hearing is going to be poor, but on the other hand, you will have the best sleep you have ever had. Story 43. I'm sorry, but you will spend some time in the bathroom. Food, while delicious, causes major gastrointestinal issues. I mean, half an hour after eating, you better be near a toilet. Society is not your friend. You enjoy being at home. Sorry for the panic attacks you will suffer because you force yourself to go to work 5 days a week. Yes, you will be cold when it is 85 degrees and humid outside. No, we do not know why yet. Keep a light hoodie nearby. Everyone already thinks you are weird anyway. Enjoy the peanut butter chocolate square you treat yourself to once a week because you have learned that sweets do not always have to be part of every meal. Lastly, yes, you are not good at running, but you really do enjoy it. You do like running in the hottest part of the day with the sun glaring on you. Story 44. I have Ehlers-Danlos syndrome, so caregivers need to prepare for the amount of pain they may experience and learn how to put dislocated joints back into place. They should know how to recognize signs of severe infection and go to the emergency room promptly. Show them all the braces and how to put them on. Learn my symptoms of low blood sugar and get a snack immediately because I can go from feeling fine to very unwell quickly. Avoid being outside for too long. My body cannot handle heat due to dysautonomia. Story 45. Any food will cause pain, but not eating for more than 2 hours causes nausea and dizziness. The dry feet are a hopeless case. Just let them protect you from random Legos on the floor. The severe stomach pain from 8 p.m. to 2 a.m. every night is something you have to deal with. No medications are allowed because there is an extra passenger in the uterus. 4 liters of ice water each day are necessary to keep things running. Expect an hour around noon to be blocked off for a nap each day. Story 46. Please remember to eat breakfast and shower in the morning. Also, avoid doing anything productive within 4 hours of waking up or before morning stretches. It will not go well. Story 47. Knees hurt. There are many food types the small chopped stomach cannot tolerate. No hunger, ever. The legs swell a lot. Must take many pills every day. Idiopathic tremors are annoying. Ears ring. Must cover the scalp or it gets sunburned. A neurodivergent brain does not think like other people. Do not swallow the tongue stud. Allergic to many things. Asthma. Orthostatic hypotension means fainting can occur at any time, and symptoms may not be recognized, though I do. Really, just do not do it. Story 48. Do not miss my infusion treatments at the hospital. Do not run. If you do, there is an inhaler on the table. Take my medicine. Do not eat nightshades, peanuts, soy, or avocado. Let me write all this down because you are not going to remember. Story 49. Occasionally, you will feel nauseous and vomit. Sometimes migraines cause this, sometimes they do not. Do not worry about the lack of appetite. As long as you can manage to eat a sandwich or so each day, you should be fine. There is no temperature control. You will always feel either too hot or too cold, with no comfortable middle ground. Story 50. Restless leg syndrome. Irritable bowel syndrome. Do not eat gluten, dairy, or corn syrup. Sensory sensitivity. Allergies. Asthma. My feet hurt. Random headaches. Story 51. Absolutely no alcohol or drugs. My sobriety is very important to me, and I have left all of that in the past. Also, my dog is equally important. Story 52. Okay, yes, he is big, but his appetite is not. Also, please make sure to drink 1 gallon of water a day, or you will get headaches. Story 53. The thyroid is severely damaged, so be prepared to feel tired 24/7, especially after eating, and frequently nauseous without warning. I have had 2 hernias as well. Additionally, I experience painful periods every month. I also suffer from chronic allergies and poor eyesight. Story 54. Only the medications in the white basket are approved. No alcohol, sushi, or cold cuts. Do not let the preschooler headbutt you in the belly. There is a fetus in there, as you will realize when it becomes apparent that you have to manually lift the belly in order to get all the urine out. Sorry about the pelvic floor. Story 55. Do not try to walk through the alcohol aisle in markets. Run from anything that smells like it. Otherwise, you may wake up not knowing where or when you are, surrounded by dead bodies and blood, without understanding what happened. This is a parable told on purpose. Story 56. Do not skip the Vyvanse 50 milligrams medication for attention deficit hyperactivity disorder in the morning. You will be very unproductive if you do. Once you take the medication, be prepared for some side effects such as a dry mouth and an upset stomach. Also, do not be alarmed if you feel lightheaded after standing for too long, or when your heart rate increases significantly after turning over in bed, getting up, or even coughing. This condition is called postural orthostatic tachycardia syndrome. It is generally harmless but can be inconvenient. Additionally, you may experience difficulty with social skills and feel overwhelmed and overstimulated by many things because you have autism spectrum disorder. Story 57. You will wake up in a female body of normal weight, with larger than average breasts and no chronic pain. You may attract more attention than before, and people may generally be friendlier to you. You are not horrified by your reflection in the mirror. However, mental health challenges remain. Your mind races constantly, with baseline anxiety and a general unsettled feeling about life. Random panic attacks may occur while driving or at work. Take your mental health medication every morning. You will strongly crave alcohol almost every evening. If you do not drink, you will have difficulty falling asleep and frequently awaken in night sweats. You will also have terrifying and extremely disturbing nightmares. You feel shame about this and experience imposter syndrome. Nightmare examples. Recently, I had a very bad one where my hospital was completely engulfed in flames. My coworkers and patients were still inside, and I was trying to call emergency services after running outside. Other recurring themes include active shooter situations with graphic details, plane crashes, tidal waves, and floods. These dreams sometimes seem to last for hours. You have a short temper and become angry easily. You will find it difficult to sleep past 5 or 6 a.m. So, you don't have many physical issues, but you will have to manage the mental health challenges. Story 58. Just a heads up, that pain is constant. No, it does not go away. Sorry about that. The gallbladder is missing, so do not eat any greasy foods. Also, be careful about the spine. There was some metal installed a decade ago, and it is starting to break down. Absolutely no alcohol unless you want to keep drinking it for a few months at once. Also, this is a Model S, meaning sadness. Make sure you feed it the right chemicals or it might break down. Post-traumatic stress disorder is not normally too difficult to handle anymore. This model comes with a service dog that should manage the flashbacks and resulting self-harm that ensues. Since we added the dog, it has prevented 90% of flashbacks, and the reduction in self-harm has been mostly successful. Make sure absolutely nothing happens to the companion dog and that it is well taken care of, or the model will self-destruct. Lastly, that little temper switch is finicky. It will flip for no reason at all sometimes, and it will take everyone's effort to prevent it from going into aggressive mode. Good luck. Story 59. Hurts to eat, hurts to drink, hurts to exist. It gets much worse if you skip any of these medications. Story 60. I really hope whoever lives in my body is a man who enjoys large breasts. Go ahead and enjoy that back pain too, buddy. Story 61. Do not drink alcohol. Your body will not react to it as the depressant that it is. Instead, your body will respond as if it is a stimulant similar to cocaine. You will experience a ridiculous amount of lasting energy, flights of ideas, and want to go on a 10-mile run. This sounds fun in the moment, but the 5 days that follow will be hell. You will feel very low and depressed, making it difficult to complete even the simplest tasks, unless you continue drinking alcohol to maintain that high. Story 62. I would not warn them about anything. Hopefully, they would be concerned enough to schedule all the doctor's appointments I need, but am too terrified to book on my own. Story 63. Do not eat anything too spicy or you will have diarrhea and gas. Do not eat anything too greasy or you will have diarrhea and gas. Do not eat anything too fried or you will have diarrhea and gas. Do not eat anything with seeds or nuts or you will have diarrhea and gas. Do not eat anything with too much cheese or dairy or you will have diarrhea and gas. Absolutely do not eat Cold Stone ice cream or you will have diarrhea. If you eat Taco Bell, you have precisely 20 minutes from the last bite before you will have diarrhea and gas. Other than that, have fun. Story 64. My knees hurt. Don't skip the gym. Construction is difficult. Power through the pain. Gastroesophageal reflux disease, by the way. Story 65. Beware the wonky hip. Also, good luck remembering most things and you are going to be fine. Ignore the 3 a.m. call to the void. Story 66. Do not eat meat after 7:30 p.m. You will wake up with horrible gas at around 1:45 a.m., and it will keep you awake for at least an hour and a half, meaning you will not sleep well. Story 67. Do not eat about 2 hours before you go to bed, or else you will have acid reflux in the middle of the night. Do not try to fight the reflux. Just take the antacid tablets next to the bed and try to go back to sleep. The baby often decides to have a dance party at about 2 a.m. most mornings, which is difficult to sleep through, but try to rest. Yes, everything is sore and uncomfortable. Try to elevate your feet as much as possible because you are starting to swell. Story 68. You will probably struggle every day with going out. I have agoraphobia, which stops me from traveling great distances. Story 69. Hidradenitis suppurativa, severe anxiety, obesity, untreated attention deficit hyperactivity disorder, panic disorder. Story 70. Cutting of the stream does not work properly anymore. It seems to work fine at first, but sometimes after about a minute you will find that it did not. Always wear dark pants. Story 71. Watch out for low door frames and low-hanging objects in general. This body is not compatible with a world built for short people. Story 72. Yes, that pain is normal. All of it? Well, yes. It must be standard. Isn't everybody in constant pain all the time? I know your skin feels wrong, too tight and too much, but it is fine. Oh, and if you forget to take your medication, you will probably pass out on the kitchen floor. Good luck, have fun, goodbye. Story 73. If you move your jaw left and right, it may make a popping sound. Do not do this too much or it may cause pain. If your jaw is moved too far to one side, you may not be able to open your mouth fully. Story 74. Try not to turn your head to the right too quickly. Could be the last time you turn your head to the right for the rest of the week. Story 75. The constant pain, the random dizzy spells and headaches, the constant brain fog and fatigue. Eat every 2.5 hours or you will pass out. Use the tailbone pillow. Do not sit down without it. Those are just the physical problems. Story 76. Not really a small thing, but impactful. I have multiple sclerosis, and it makes many activities, especially walking, difficult. I would have to warn them most about the heat sensitivity. Story 77. I would love this with Microsoft and migraine. Depending on who they are, I would let them stumble into this and see what they say afterwards, to be honest. If it is someone I love, I would write them a manual about which medications are for what kind of movement is helpful, what to avoid, and so on. But I guess what I want most in life is to be understood, believed, and judged less. Because from the outside, you cannot see anything from that spectacle. Story 78. You have attention deficit hyperactivity disorder, borderline personality disorder, generalized anxiety disorder, complex post-traumatic stress disorder, and arthritis. The traumas just keep stacking up. Take care. Story 79. Here is the suitcase of medication and all the robot parts. Do not forget anything. The brain is inside out and upside down, not literally, so everything will be different. Avoid local anesthetic. Stay away from cannabis smoke. Synthetic opioids will not work, so do not waste your time. Any joint can wander off at any time. I am not sure what to advise about pain. Can you afford a massage? Story 80. The back is injured. Do not sit or stand still for too long. There is anxiety and epilepsy. Please remember to take the medications for that. Also, please do me a favor and quit smoking for me. Story 81. I absolutely was not expecting all of these responses. I wish everyone well and good luck with whatever daily struggles and battles we face. Love and support from me to you. Story 82. When you wake up, stretch in bed. Make circular movements with your wrists and ankles. Touch your toes. Then stand up, you will not fall. 75 here. Story 83. Oh my, I'm already so sorry. You're gonna pass out or feel like you will all the time. At least once per day, you'll be positive you're going to vomit. You probably won't, but be wary. Apologies for the excess sweating. It's new and we don't like it either. Everything to do with perimenopause is unpleasant. Most things you eat will make you feel bad, not forever, but for a few hours. Cheese and carbohydrates are the exception. Go nuts. Story 84. If you stand up too quickly, you will pass out. Also, if you stay in the heat too long, you will pass out, including and especially during hot showers. Additionally, everything you eat has the potential to keep you on the toilet for hours. Good speed. Story 85. I have multiple chronic illnesses, most well managed apart from my pain condition. Good luck surviving this. Story 86. Spinal cord injury. One day, I will have trouble getting out of bed. The next day, it may not be so bad. Predicting which day will be difficult is almost impossible. Story 87. The head is always full of audio-video noise. Mostly everything hurts. There is a twitch for a split second when concentrating on controlled muscle movements. I bump into every conceivable thing that is only slightly in the way. I have a high pain tolerance, so it is no big deal unless it is the right knee. Do not bump the right knee. I cannot walk straight without actively stabilizing due to an ear issue. I have to actively remember how to write, form letters, and talk. I have no family members. Sometimes I am confused about exactly where I am in time. I sort of lose vision in my right eye for brief moments. The cause is as yet unknown. I am allergic to old shellfish. I hate chewing noises. My left shoulder will dislocate when I am too tired. The right temple feels like being put in a vice when I am stressed out. Medications require larger doses. My hair grows very quickly. I had to leave some things out. On the plus side, I am a little artsy and a fast learner. Story 88. The severe, continuous acid reflux occurs all day and every night. It will probably keep you awake and prevent you from eating much. Help. Story 89. The sleep medications do not work. Take them anyway or you will jeopardize my insurance. Caffeine does work, but only if you do not mind it making you sleepy sometimes. Do not interfere with the Lamictal. Do not take anything extra with the main pill doses. You have to wait an hour or else you may vomit. Wear a corset or binder. It helps with panic attacks. Enjoy the synesthesia. I have mostly the pleasant kinds. Be careful of the ankles. They can betray you. Accept that the nose is entirely hostile and make the dog smell the milk before you use it. Story 90. Good luck leaving the house without a peaked hat and dark glasses. You will not be able to see because of glare most of the time. Forget about driving. Forget about styling your hair if you leave the house. See the hat comment. Your knees sound like microwave popcorn all the time. You will get random shooting pains in your elbow. There is one tooth that will cut your tongue occasionally. Your brain will continually function in GIF and meme mode and sing at you at the same time. Story 91. Statistics indicate you are likely able to see over fences and crowds that typically block vision. You will also be able to reach top shelves in most places with ease, so do not be startled. It is important to know how to use contact lenses. Be careful with the shoulders and ribs. They tend to move out of their proper positions. If you do not tense the muscles around the shoulders, they may literally fall out of the sockets when you lift something. This will not affect your daily life as long as you remember this. The ribs, however, seem to have a mind of their own and can cause discomfort ranging from barely noticeable to feeling like you are being stabbed in the back with every inhale. This can make it feel as if all the air you just inhaled is immediately expelled without your control. Story 92. Be prepared for constant pain in your hands, wrists, elbows, knees, ankles, and feet. You will come to dread standing up, and walking will be a challenge as your knee may randomly give way. Be careful of any cuts or scratches, as infections set in quickly and, due to immunosuppression, do not present as they typically would. Any minor cut can tear through your skin, requiring an emergency room visit and many stitches. It is essential to remain very clean to avoid cuts, infections, and severe complications. Story 93. Listen carefully. Be careful with the back. It is always causing trouble. Take good care of the hands. I need them to massage. If you feel like there is too much desire, it is normal. Story 94. Congratulations. You have been transferred into a lemon body. If it hurts, it is broken. Seek medical help as soon as possible. Story 95. Sometimes the kidney stone causes pain if you do not drink 3 liters of water per day. You may lose depth perception. Ignore the music and voices in your head. It is just the neurospasy talking. Story 96. Walk up and down stairs with your feet angled to the side. These feet are too big to fit on stairs, and you will slip if you try to take them straight-footed. Story 97. Do not raise your arms above your head. If you start to lose your vision, sit down quickly. Do not kneel or bend backward. Whatever you do, do not pull the tube. Story 98. First of all, sorry that everything hurts. That is normal. You need to squeeze your legs into thigh-high compression socks every day, or you will get blood pooling by the end of the day and possibly pass out the next time you are standing. Do not forget to hydrate and consume electrolytes, or you will get a migraine and pass out. Also, take your beta blocker every 8 hours or you will feel very ill. Remember to take all 6 prescriptions every morning. Avoid wheat, coffee, yeast, oranges, and tomatoes. If you have an emergency, one epinephrine autoinjector is in the blue work bag, and the other is in the ceramic swan in the living room. Good luck. Story 99. Buckle up. You are in for a difficult time. Multiple medications must be taken at different times throughout the day. The consequences are serious if you stray. Palpitations, rapid heart rate, fainting, feeling like you are dying, and if it progresses, uncontrollable vomiting that may require an emergency room visit. You cannot lie down for 4 hours after taking one of the medications. You must avoid repeatedly bending over, becoming too hot, standing for too long, getting up and down too many times, turning too quickly, performing excessive physical activity, or sitting in the same position for long periods. You need to sit with your legs elevated as much as possible, but be careful when standing up, as you may feel like you are in a rapidly falling elevator. You may feel like you are dying at times or that something is terribly wrong. Ride it out. It will eventually pass. Cannabis may help. You must consume at least 4 liters of water and 10 grams of sodium daily. You will urinate every 1 to 2 hours. Be careful when getting up to urinate because you might faint. Story 100. Here is the deal. What you see is not what you will get. You are 34 and look able-bodied, but you have many invisible disabilities to learn about. The connective tissues in your body, including ligaments, allow most people to move and function while keeping bones in place. Yours are very stretched and weak due to Ehlers-Danlos syndrome, making them prone to damage like old or cold rubber bands. You will likely experience about 50 partial joint dislocations and full dislocations this week, possibly more as you adjust. You must wear all compression braces and garments. There are 10. Do not complain. These and 4 years of physical therapy are the only reasons you can function mildly. Do not try to get out of bed without knee braces and orthotics. These are critical even for midnight bathroom trips. You cannot swivel or slide onto any seat or bed that is not smooth plastic or wood without a nylon shopping bag underneath to help you swivel. Keep your legs together and aligned when you swivel. You cannot do stairs unless you place a yoga block on each step, cutting the height in half. Do not stand in the shower, use the transfer bench. Only sleep on your back with approved pillows under your neck, knees, and ankles. Do not roll or move as you will dislocate joints, and it hurts if you sleep more than 4 to 6 hours continuously. Wear your ankle wraps to sleep and do not put your feet under the covers. The blanket's weight will cause dislocations. We have soft down slippers if you are cold. Good news. Exits are easy and entries are easier. Most relocations can be done at home. I will provide videos to cover how to relocate ankles, ribs, hips, sacroiliac joints, wrists, and shoulders. We do not manipulate cervical or thoracic spine shifts. Leave those until physical therapy. Physical therapy is critical. You will attend twice a week and pay whatever they ask. You will do all home exercises consistently. You also have postural orthostatic tachycardia syndrome. If you start feeling dizzy and numb and are about to faint, get to a safe position immediately. You likely have about 10 seconds. You will probably faint 8 to 15 times this week. This is normal. Try to make your safe position look like sleep or rest if in public to avoid alarming others and skipping unnecessary emergency room visits. You also have mast cell activation syndrome and severe allergies. Take all medications exactly as prescribed. Only 18 ingredients are safe for you to eat and must be prepared fresh for every meal. Do not deviate or you risk anaphylaxis. Random chemicals, pollen, mold, scents, and detergents may also trigger reactions. Keep HEPA filters running at home at all times. Carry your respirator, diphenhydramine, and EpiPen with you everywhere. Use only approved products which took much trial and error to determine. Avoid places with strong smells and put on your respirator as soon as you detect a trigger. You may sometimes be able to manage mild reactions without emergency treatment. If your vision blurs, vertigo starts, or your head feels stabbed or crushed, you may have a migraine or upper cervical spine displacement. Try lying down or putting on your cervical collar first. If that fails, use the migraine kit. Prescription migraine medications are very expensive and limited, so only use them if all else fails. You always have some degree of headache. If you can still function, avoid the prescription meds. You get only 8 per month and have more than 20 migraine days. Good news, you can do difficult things. You are persistent and creative because you live in a world not designed for your body or needs. You are a problem solver who has found many solutions. You have a great sense of humor and a wonderful garden of safe foods. Your life will probably look different from what you are used to, but slowing down will help you understand young children, disabled people, and the elderly better. You helped your grandparents as they aged and passed on. Hopefully, what you learn in this body for a week will give you new perspective. You've got this. Story 101. You are going to have to drink a lot, or you will experience delirium tremens and have to go to the hospital. Plus, you have to take all of your psychiatric medications or you will end up in the mental hospital. Besides that, have fun. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.